to introduce the medical college speaker. Sally Elgazar was born in Cairo, Egypt. Sally spent her early childhood and education before moving to Qatar at the age of 11. She completed her high school studies at Amna bint Wahab Independent School with honors and received a shield in community and cultural development. Sally joined Weill Cornell Medicine Qatar in 2009. During her studies at Weill Cornell Medicine Qatar, Sally was elected by her classmates to be their representative in Medical Student Executive Council for all of 6 years. In 2012, her peers voted for Sally to receive the Outstanding Community Developer Student Award. Sally has worked on several recent projects, 2 of which were in cooperation with Qatar's Robotic Surgery Center, developing guidelines for medical image processing for clinical diagnosis and surgical procedures. In addition to that, she has worked in the Weill Cornell labs on detecting different base mutations in polycystic kidney disease patients. Sally plans on doing more research before pursuing a residency in internal medicine next year. Sally Elgazar.
Bismillah. Your Excellencies, Dean Sheikh, Dean Gautam, Dean Glimsher, and Dean Todd, family and friends, professors and staff, my fellow classmates, good evening. After a long, tiring 6 and to some 7-year journey, I'm proud to say that we have finally reached here, the culmination of all of our hard work. I heartily congratulate all of us on a job extremely well done, if I might say so myself.
Yeah, good job.
But beyond our joy today, beyond our elation and all of the reminiscing, I truly believe that the deepest feeling that we have today is gratitude. My fellow classmates, my fellow graduates, and I will always be indebted and grateful towards Her Highness Samo Sheikha Musa bint Nasser, whose vision has built this prestigious city of education. His Highness Samo Sheikh Tamim bin Hamad, Amir Dawlat Qatar. His Highness Samo Sheikh Hamad bin Khalifa al-Thani, al-Amir al-Wali. The Qatar Foundation, the place that has grounded more than 50 nationalities worldwide under the flag of education and research, our second home. To our dearest faculty, visiting faculty and staff from both Weill Cornell Medicine in Qatar as well as Weill Cornell Medicine in New York. To the dedicated physicians and staff of Hamad Medical Corporation right here in New York Presbyterian Hospital in New York. And finally, to our parents, to our family, to our friends, the pillars, the true pillars to our foundation. Your support and understanding through all of these years is what truly brought us here. My friends, let me say that today I won't be speaking about all of our accomplishments through these years. I also won't be speaking about how we're going to change the world, because I know we will. I think our presence here is just proof of that. Today, I would like to speak about the most basic interaction in medicine. And this is a final attempt to remind all of us as physicians as our true aim. I would like to talk about empathy and how 80% of most physicians might forget about it. You see, what we discovered is that it is very easy to forget, to be absorbed in the moment that is right in front of us, that it's just only normal to forget why we started this journey. Am I being too abstract? Let's be more concrete. 20 years from now, we all will have gone our separate ways. Allow me to take somewhat of a large detour as I describe where we all will be. Will be our next great transplant surgeon, while Rana will have her own private clinic treating psychiatry and pediatrics in Oklahoma. Vignesh will be curing cancer, all the while doing 3 clinical trials, contributing to the Cancer Genome Atlas, and of course, eliminating antibiotic-resistant bacteria.
All right.
But the last, of course, cannot be done without Muti, who is now the head of the infectious disease department. Ikram will be on her yacht. She will be on her yacht watching whales while conducting therapy sessions through her iPad. Nama, Maryam, as well as Hamid will be the owners of the largest children's hospital in Dallas. Mustafa, of course, will be defending the voiceless and fighting for the rights of all others. Lama, in the meantime, she will be in the OR, operating with the Da Vinci robot with one hand while lifting weights with the other. Ibrahim, who is now a senior urologist, will have brought all urologists together to finally decide whether we're going to use PSA as a prostate cancer marker or not. Amin and Sia, who are both more than equally qualified doctors, will be arguing over who of them will be the internal medicine director in Case Western. Meanwhile, Hiba has quietly overtaken that position in Ghana. Wait, let me correct that information. Amin has actually just agreed to become the new Yemeni Minister of Health. You go. Miles away, my friend, who is an expert food connoisseur, will have built a hospital where the patients are both staying for the excellent medical care and the heavenly cuisines offered. Nur Al-Tawi will have single-handedly initiated a nationwide program to rehabilitate drug addicts in prison. Kareem, obviously Kareem, you will have gone under the radar for 20 years until we finally discover that you're behind the most cures of rheumatic diseases. And Naveed, who's now an emergency medicine physician, will of course be helping in underserved populations and working with Doctors Without Borders. While on the other side of the world, the most senior emergency medicine attending, Dana, well, she will still be holding suturing sessions for medical students, but that's when she's not teaching her residents how to save lives. Arim, of course, will be managing the first medical and surgical dermatology center here in Qatar, and juggling her own skin line product. Nadine, who's become the physician's physician by eliminating the most serious killer of doctors, stress, will have become a world-renowned author by creating P90X techniques for doctors. Rashid, who I think was the only one who knew since pre-med that he wanted to become a cardiac electrophysiologist, has now become a world-renowned authority on arrhythmias. Abdul Hamid, you, has mastered the art of singing while doing endoscopies and colonoscopies to relax your patients. Yassine, on the other hand, who is now a very prominent cardiologist, frowns upon Abdul Hamid's unorthodox way of relaxing his patients, and of course, he is not afraid to voice his opinion loud and clear. Carola, who's now an NYP Heme-Onc professor and a visiting faculty right here in Weill Cornell Medicine Qatar, will be giving the keynote speech in class 2036 convocation. Min will be the founder of the first Center for Autism Spectrum Disorder that has animal-assisted therapy in Korea. She has found that rabbits especially are great therapy pets. And another wonderful pediatrician, when Shireen isn't treating asthmatic children in her clinic, she will be producing the first pediatric medical drama. While Hasib will be preventing rheumatic heart disease in underserved area, while teaching children how to slide tackle on the soccer field. Moza, another one-of-a-kind pediatrician, will be focusing on the gigantic mission of reducing diabetes type 2 right here in this region. Hajaji's lovely children and Sam's beautiful daughter will have finally graduated and will be following the great steps of their parents. I, of course, will be busy organizing our reunion, and I'm not trying to revive geriatrics right here in the region. And Hayan? Well, Hayan has done more than any of us combined through these years. So much so that this really short speech is hardly appropriate to mention it. Humor aside, the point is, we will all be living our separate lives, engrossed in the minute details of our day-to-day living that it is only normal to forget when we started. Each one of us started this journey to become a doctor with a specific aim in our mind. We wanted to become doctors to make our parents proud. We wanted to become doctors to help people. And in the extremely misinformed cases, we wanted to become doctors to become loaded. But along the hours and hours of hard work, the days of hospital work and dodging camping sessions, and the long, hard nights of studying, our goal became to last till the next day and survive to the next weekend. We forgot why we started this journey. It became a hardship to muster enough energy, enough just to care about that patient who needs dialysis, or the patient who needs one more doctor to see him, or the small baby who isn't gaining enough weight despite her high calorie intake. We had board exams, we had steps, we had assignments, we had due dates. Not so long ago, I had a discussion, well, it was a heated discussion with a friend. We were debating about how the progress of medicine, even the progress of science, was based on some harsh acts, including unethical human experimentation. She was of the mind that it was justified to have done these acts in order to reach what we have learned today. That it is okay to still experiment on humans to advance our scientific knowledge. I, on the other hand, adamantly refused the idea. And although I was thankful to what we have already learned, I refused to further compound our predecessors' mistakes by mimicking them. As you can imagine, we spent almost an hour arguing, because girls can argue that long. And honestly, I had reached the end of my wits when I finally said, all right, why don't you volunteer to be the next human experiment?
Yes.
She looked at me for a minute before saying, oh, I didn't think of it that way. So I asked all of us, let's think of it in that way. It was Gandhi who said that science without humanity is one of the roots of evil. Similarly, medicine without empathy is the most basic reflection of that. So let's place ourselves in a patient's shoes. Place our mothers or fathers, sons or daughters in that situation. Would we like ourselves, our parents, our children to be treated with the compassion and empathy they deserve? Or would we like their doctor to be self-involved, frowning and glowering at them while he's just performing the most basic service anyone could ask for? Because if there is anything I can guarantee, It's that we'll all be patients at one point or another. We'll all need that empathy. And we'll all have a myriad of compassionate and alternatively indifferent doctors. So be what you would prefer yourself, your parents, and your children to have. My friends, this here and now is just the end of one journey. And as we go on to the next chapter, to practicing medicine, to receiving that Nobel Prize for curing cancer, where's my wish? There you go. To treating patients electronically from my off, I implore all of us not to forget the reason why we started this journey in the first place, to help. I know that some days we will feel tired, others exhausted, that we can't even remember what we ate for lunch, let alone some fantastical romantic notion of medicine. But on the days we are not, on the days when we feel like we can and we will survive to the next glorious weekend, let us make a conscious choice to remember that the patient who needs dialysis, the patient who needs that one more doctor to see him, and that the mother of the small baby who is still not gaining enough weight, they all want, they all hope to see that next weekend too. Finally, it is both an honor, truly an honor and a privilege to announce Class 2016, Doctors of Medicine. Congratulations to all of our internists, surgeons, psychiatrists, pediatricians, dermatologists, pathologists, emergency physicians, and researchers. Thank you.